Here in Austin, heart health is becoming a part of how we live. It's a mother checking her blood pressure for the first time for prevention. It's a bystander having the confidence to step in and intervene when every second counts. It's a community choosing to show up in real and tangible ways. Our focus is clear. We're driving impact in 4 different areas. First, we're pursuing women's health and closing critical gaps in care. Second, we're building a community ready to respond to cardiac emergencies. Third, we're improving blood pressure control at scale. And lastly, we're investing in long-term solutions through our social impact fund right here in Austin. As board president, my goal is to turn these priorities into actions, and that work is already underway.
Every year in our community, thousands of individuals suffer from a cardiac arrest outside of a hospital, and too often, help doesn't come quickly enough. But we know the greatest predictor of survival is immediate action from a bystander. The reality is most people in our community are not prepared. It's not that they don't want to help, it's that they don't feel confident in supporting and helping quickly. And the good news is that's something we can change. Through the American Heart Association Nation of Lifesavers initiative, we are working to ensure that at least one member of every household is trained in hands-only CPR. Across Central Texas, we're expanding cardiac education and CPR education through community events. We're placing training kiosks at high traffic locations, and we're working with companies to ensure employees and their families are trained. We're also expanding cardiac response plans at schools and at workplaces to make sure that community members are not only trained but also competent in these events when they matter most. At St. David's Healthcare, we are proud to stand alongside the American Heart Association to build a community where anyone, anywhere can act fast. Because we know when people are prepared, lives are saved. And together, we can make Austin the best city to survive a cardiac arrest.
In Central Texas, heart disease remains the leading cause of death among women. Too many women don't recognize the risk or feel empowered to take action. Women experience heart disease differently, and too often symptoms are overlooked or dismissed. Too many women have been told they are fine when they knew something was not right. But the good news is that when women are informed, supported, and confident in advocating for themselves, outcomes improve. Through American Heart Association's Women's Health Initiatives, we're meeting women where they are with education, community, and culturally relevant engagement. Go Red for Women is more than just an event. It is a movement where women come together and understand their symptoms, understand their numbers, and feel empowered to do something when something doesn't feel right. Vestido Rojo creates a space where Hispanic and Latina women feel seen, heard, and supported, ensuring language, culture, and access are not barriers to care. Throughout the year, we are building a connection of women who are informed, engaged, and taking action together. The American Heart Association is advancing women's health all across Austin because women are supported to lead their own health journeys. Families are stronger, communities are healthier, and lives are saved.
The future of our community's health depends on the next generation of leaders, and that starts with engagement today. Too often, young professionals are seen as future supporters, not as current change makers. But the reality is, they bring fresh perspectives, energy, and influence that can drive real impact right now. They're not waiting to lead, they are already doing it. Through the American Heart Association's Young Professional with Heart Junior Board, we are creating meaningful pathways for individuals to lead, connect, and give back. The initiative goes beyond networking to focus on purpose-driven engagement, from hands-on volunteering opportunities and peer-to-peer fundraising to leadership development and community impact initiatives. We are equipping young professionals to take ownership of heart health in their workplace and communities. At the American Heart Association, we believe leadership doesn't start later, it starts now. Because when young professionals step into purpose early, they don't just shape their own future, they build a healthier, stronger Austin for everyone.
High blood pressure is one of the leading causes of cardiovascular disease in Central Texas. This impacts everybody. your friends, your loved ones, your coworkers, and nearly half of adults don't know that they have an abnormally high blood pressure. The good news is that it's preventable, and organizations like American Heart Association work with communities to make sure that they have access so that they can prevent the effects of cardiovascular disease. One of the reasons that I love working with the American Heart Association is that we meet people where they are. We're launching a Check It Challenge this fall. Also, we have put self-monitoring blood pressure stations in communities, in employer organizations, so that people can know their numbers. And that, at the end of the day, is what we all need to do. We need to know our numbers so that we can take care of ourselves, so that we can take care of our loved ones. At Ascension Seton, we are proud to support this work because ultimately it helps Austinites understand their numbers and prevent the devastating effects of heart disease.
At the American Heart Association, we're also focused on long-term solutions to the community's health here in Austin. While the immediate impact is important, focusing on a 3, 5, 7-year outlook for our community is also vitally important. One of the ways we can do this is through the Social Impact Fund that we are launching here in Austin. We all know that health is shaped by factors outside of the doctor's office as well. Access to healthy food, health education, a safe environment to live and work are all extremely important factors to the long-term health of the community here in Austin. And that's what we are focused on here with the launch of the Social Impact Fund. Through this multi-million-dollar fund, we'll be investing in local, community-driven solutions that address the root causes of health inequalities. By providing both capital and support to these smaller businesses, we can help these businesses go from an idea to a larger opportunity that can have a meaningful impact on our community. At the American Heart Association, this is about building a healthier Austin for the long term, where every person, every neighborhood has access to high-quality healthcare that can impact the lives of themselves and their families for future generations to come.
It's that lasting impact that will make the difference. What makes Austin unique is how quickly people move from caring to action. When a community aligns around a shared mission, real change follows. We are seeing it in boardrooms, in neighborhoods, in schools, and at community events across the city. People are stepping up, leaning in, and taking ownership of the health of this community. And when that happens, momentum builds in a way that is hard to stop. This is what it looks like when a city decides to take care of its own.
What inspires me the most is how many people have chosen to be part of the solution. We know the facts. Cardiovascular disease continues to be the #1 cause of death for men and women. With every screening, with every event, with every conversation, we are moving towards changing that stat. I've had the privilege of seeing the American Heart Association in Austin evolve over time. And as I reach the end of my board chair term, I could say with confidence, we are stepping into our strongest chapter yet. The level of energy, engagement, and commitment, leadership from this community is unlike anything I have ever seen. This is the heart of Austin. Together, we are changing outcomes and building a healthier future.